Welcome to the True Skin Experts Podcast, your trusted source for clear, science-backed information on skin health and beauty. Presented by American Society for Dermatologic Surgery board-certified dermatologists, the episodes break down topics from skincare to medical dermatology and cosmetic procedures, so you can feel confident in your skin health decisions. Whether you're managing a skin condition, exploring cosmetic options, or just curious about the best skincare practices, we're here to empower you with expert advice, one episode at a time. Enjoy this episode recorded live at the 2025 ASDS Annual Meeting, showcasing the energy and innovation that make the dermatologic surgery community and ASDS members the true skin health and beauty experts.
Welcome to the ASDS True Skin Expert Podcast. Each episode, we invite you to learn about skin health and beauty from the True Skin Experts, ASDS Board Certified Dermatologists. So today we're really excited to be talking about collagen, a popular topic that our patients ask us about a lot. Stay tuned because you'll learn about why collagen is important, the procedures and things that dermatologists recommend to boost collagen, and we'll also bust myths about things like topical collagen and other mistruths and misconceptions that you might be wasting money on. So I'm very excited to be here with my co-hosts, other dermatologists. I'll quickly introduce myself and then they'll introduce themselves. I'm Dr. Kemmy Mokaya, and I'm a board-certified dermatologist based in Houston, Texas. I work in private practice and blend medical, surgical, and cosmetic dermatologists to help patients look and feel their best. So a fun fact about myself, I love traveling and I've been to over 30 countries and I've lived in the US for about 20 years. If you can tell I have an accent, I'm from Kenya originally. And one of the places I've lived in is Connecticut, where I met Dr. Brianna, and I'll hand it over to her to introduce herself and where she's from.
Great, thanks Dr. Kemmy. I feel like we've known each other for quite a bit of time at this point. So my name is Dr. Brianna Olamiju. I'm currently a board certified dermatologist based in New York City. And I typically do a mixture of both medical derm and cosmetic dermatology. And I'm really excited to be here with my colleagues. And I'll let you introduce yourself.
Thank you. I am Dr. Maral, Kibarian, Skelsey. I'm a Mohs surgeon and board certified dermatologist based in Washington, D.C. I focus on skin cancer, where I practice Mohs micrographic surgery, a technique in which we take very small layers of skin in order to result in the highest cure rate and the best cosmetic result. I'm a clinical professor at Georgetown University, and I also am treating patients with scars and rejuvenating procedures in order to help them look their best.
Thanks for the intros, ladies. So let's talk about collagen. And just to give our listeners an overview, we'll talk about why it's important and how we lose collagen. Then, of course, we're dermatologists, so we'll talk about the procedures that we love that have backing to help build collagen. And we'll go over skincare, something that we love. And at the end, we'll go over myths and misconceptions. So, Dr. Brianna, do you want us to tell us a little bit about collagen and why it's so important in the body?
Sure, yeah. So collagen is the building block of skin. So collagen is what gives that firmness and elasticity within skin. And it's not just in skin of the face, but it's skin all over our body as well. It supports bones and joints. And over time, what happens is that we tend to lose collagen. Specifically for women, as women are perimenopausal or enter menopause, I feel like that's the time when women are starting to notice it the most. But we typically start losing collagen as early as in our 30s. But I think for me, when I talk to my patients, especially women, that's when they see the sharpest decline. But men are also losing collagen with age as well.
That is true. Dr. Skelsey, when do most patients come to you complaining about their skin and you realize that it's because of collagen loss?
You know, there's a big variation when people start to complain about that loss. Some as early as their 20s, late 20s, and then there are these kind of pivotal moments in the 40s, in the perimenopausal years, and people are very different depending on their lifestyle. There are a lot of lifestyle choices that affect the loss of collagen, namely ultraviolet light exposure, which significantly decreases collagen, and the other is smoking and poor nutrition. Collagen is a protein, and we need to have it. Nutrition is a very important part of developing our resources for our sources of collagen. So it's building collagen, but it's also loss of collagen. So maintaining it includes having a healthy lifestyle and avoiding some of the things that I just mentioned, but also sustaining other practices that will decrease the collagen degradation.
Oh, I'm glad you mentioned that. I'm glad you mentioned lifestyle, because so often patients are interested in what skincare they can use or what procedures they can get, not forgetting the lifestyle intervention.
Yeah.
Dr. Brianna, for you, do you feel like for your patients, do you feel like it's more hormones that influence their collagen loss, or do you feel like it's the lifestyle factors when you think of the ones that come to you?
That's a good question. I honestly can't pick one or the other. I think it's both. I think it's multifactorial. I think the lifestyle factors are the part that we can control. You know, the hormonal fluctuations are just natural with time. One lifestyle factor I would add is UV exposure. I feel like sunscreen, like consistent sunscreen use, is one of the easiest things that you could do to maintain your collagen as much as possible. I'm sure we've all seen that that split study of the truck driver, right? Where the left side of his face, where he was getting more sun exposure, had significantly more sun damage, more wrinkles. You could tell there was like a loss of elasticity because he was just getting a lot more UV exposure in that side. So I think it's both. Maybe lifestyle factors, I would say, play a little bit of a larger role, but I don't think I could say one or the other, to be totally honest.
I agree with you. I think it's all. I know collagen, they tell us this shocking statistic that in the first 5 years after collagen, women lose up to 30%. After menopause, women lose up to 30% of their collagen.
Yeah.
So there's definitely that hormonal interplay. But, I'm glad you mentioned sunscreen. I'm glad we mentioned lifestyle. We'll go back to that. We are currently at the ASDS conference, and we're going to be talking about procedures, because when patients come to us, this is our expertise.
Yeah.
So I think we'll start with microneedling, and we'll go over several procedures. Dr. Skelsey, do you want to go over what microneedling is and how it helps collagen?
Microneedling is a very safe procedure in which sterile needles, very fine needles, enter the skin, releasing growth factors that stimulate collagen formation. And this procedure is done over several weeks and months. And each time it's performed, there is improvement in the skin, but it's something we see a cumulative effect after the procedure is performed over multiple times. And it can be combined with other agents like PRP, which is platelet-rich plasma, and that potentiates or improves the effects of the microneedling. It's a very natural procedure. It's not an injection. It's something in which we allow the patient's own collagen to be formed through that stimulation by the needles.
Absolutely. Dr. Brianna, how do you decide which patients you'll recommend microneedling to?
Yeah, that's a great question. I would say in our arsenal of different options that we have for patients, I would say that microneedling is one of the least invasive. Typically, it's pretty cost effective for patients. So if there's a patient who's a little bit younger, they just want a boost of collagen, but they don't want anything that's super invasive, they want low downtime, I feel like that's typically the patient that I would recommend microneedling for, but honestly, anyone can do it.
That's true. Have any of you had microneedling done before?
Oh, absolutely.
I love it.
It's a great procedure, and it's not just for photoaging, but it also is a great treatment for scars, both traumatic scars as well as acne scars. And it's men and women actually benefit greatly from the procedure.
Absolutely. Yeah, I love it too. I get it done twice a year, and it's wonderful. All right, let's move on to another procedure. Let's move on to lasers. And Dr. Brianna, do you want to go over like ablative and non-ablative lasers, just really briefly, so that patients can know what they are and how they help our bodies build collagen?
Yeah, of course. So typically when it comes to lasers, I think of them in two arms. There's the ablative lasers, such as like the CO2, and then there's the non-ablative lasers, which there's a ton of non-ablative lasers. But the CO2 lasers tend to require a little bit more downtime, right? Because you are ablating the top layer of the skin, and then you're also targeting the deeper layers of the skin as well to promote collagen. Whereas the non-ablative lasers, while there is still a little bit of downtime, it's less downtime required compared to the ablative, and that's targeting the deeper layers of the skin to promote collagen. So in certain skin types, you can do an ablative laser such as a CO2. I will say it's not safe in all skin types. Like for example, in my skin type, I would not do an ablative laser just because it's not safe to do that. But if there was a more fair skin patient who has fine lines and wrinkles, I think they're great candidates for a CO2 laser. But the non-ablative lasers are pretty safe in most skin types. I will say in skin of color, again, you have to take a little bit more caution. So just to make sure that the patients are going to like a board certified dermatologist who's well versed in it and has done it many times before in all skin types.
Absolutely. Dr. Skelsey, can you think of any patient story or of any dramatic transformation in a patient that you've had who's had lasers for skin rejuvenation?
I had a patient recently that she'd gone through a big life change and she suddenly found herself single. She'd really lost a lot of confidence and she'd had a lifetime of, unfortunately, a lot of smoking and sun exposure. She was really otherwise healthy. And after 2 sessions with an ablative CO2 laser, which did have some downtime, she was really transformed. Her skin looked about 10 years younger than she had been, and it was something that gave her so much confidence. She started going on the dating apps and now has a serious partner. So it's really nice to see.
That is amazing. That's a great story. And I love what we do because we can really change lives and quality of lives. And, even though we don't deal with very acutely sick patients every day, just improving people's quality of lives and making them happy again, it's what makes our job so much fun.
It does. And I will say you have to tell patients to trust the process.
Absolutely.
I think with an ablative laser, sometimes they will walk out looking a little bit scary, but you just have to tell them, like within a few weeks, there will be a huge transformation and you just have to be patient. It's not like you're gonna walk out of the office looking totally transformed. Again, building collagen takes time. There's no quick fixes for this.
Absolutely. People really do have to trust the process. Well, let's move on to another procedure that we like. I personally don't do this in my office, but let's talk about radiofrequency and radiofrequency microneedling. And then Dr. Skelsey, do you want to tell us the differences between the two?
So the difference between microneedling and radiofrequency microneedling is that in radiofrequency microneedling, those microneedles deliver radiofrequency energy deep into the skin. Mm-hmm. So it's considered non-ablative. In other words, the surface of the skin is not completely removed, but that energy helps to develop collagen. It is something that has a little bit of downtime. So the skin is somewhat pink. There's a kind of a sandpaper texture to it. It's often a little bit swollen, but over the course of weeks, starting usually about 4 weeks after the first procedure, the collagen is built up. And I had a patient who did beautifully, had a birthmark where there was atrophy of the skin. So it was kind of loose, a real significant loss of the collagen underneath. And her collagen over 3 treatments with the radiofrequency microneedling really grew significantly, so that there was much less difference between the right and left sides of her face. So it is a little bit more involved than microneedling, mm-hmm. and has a little bit bigger payback.
That's true. That's amazing. Dr. Brianna, have you gotten any pushback or heard of any of the controversies around radiofrequency microneedling?
I have. I feel like that's been in the news a lot lately. I think the thought is that they're saying that it could potentially melt fat. Mm-hmm. And I've spoken to some of, the reps from the different companies, and a lot of them are saying that their specific device does not. I think you have to go to a board certified dermatologist that you trust because, different hands, I feel like different devices work differently. Personally, I have not seen any fat melting, and I think it depends on how deep within the skin that you go. But I have heard stories, and I've heard it from patients that they've, seen a difference in themselves. But for me, I have not seen that personally. Have you seen that?
No, I haven't.
I haven't seen that either personally, but I've heard a lot of reports again of people going to the med spa or just somebody who's not very well skilled in the machine who uses too much heat and too much energy, and they'll get the scarring and the meltdown of fat. So it's really important to choose your board certified dermatologist and to really talk about procedures and know that you trust and are confident in the person who's doing your procedure.
Exactly.
All right, let's switch topics a bit because we don't have that much time. Let's talk about injectables.
Yeah.
Dr. Brianna, when it comes to injectable, what should patients expect during and after treatment? And what injectables do we use that stimulate collagen production?
Yeah, so we have different types of injectables. So there's the hyaluronic acid injectables that are filler. And basically for those, it gives you an instant effect, right? Because you're putting hyaluronic acid directly in the skin. And those are good for patients that might feel like their skin is getting a little bit droopy, or they want volume, especially in the cheeks, or they want like a more refined, more definition in the jaw area. But then we also have the other type of injectables that are a little bit, it's more about the waiting game. So you have injectables such as like viral injectables where you inject it in the skin and it's not an immediate result, but over weeks and months, your skin is building and boosting its natural collagen production. And I feel like that has been really a game changer in my practice. I think initially I was hesitant to do it because I'm based in New York City, and I feel like in New York we all want instant results. But for my patients who are maybe like a little bit on the younger side and are willing to wait, I feel like it's a really great natural way to boost your collagen. I will say sometimes you might walk out the office looking a little bit like poofy and fluffy because you are getting a lot of volume injected in your skin. But that goes down, within a couple of days, and then over the course of weeks and months, patients really do see that their collagen is building. But again, I tell people you need a series of these because you might see, improvement with just one vial, but it takes time for it to continue to build.
Absolutely. Dr. Skelsey, what's your experience with the injectables and building collagen and just helping patients out?
Well, I really have started using much more of the biostimulatory. These agents are what stimulate fibroblasts to make the collagen, and as you pointed out, it's a gradual process. But I've also found that it's not just building up the collagen, but the skin quality improves. So there is a more elasticity of the skin itself, not just the underlying structure. And with so many people losing weight these days and a kind of a rapid weight loss, it's really found a place in my practice to give a very natural, restorative appearance. So kind of taking people back several years and lifting them up, and by having them build up that underlying collagen. But with all of it, it's a good skincare routine that needs to be coupled with these injectables.
I agree with you. With so many people losing weight, these injectables will be really important. I just wanted to underscore the importance also of going to the right person to inject them, because some people inject them too deep into the fat, or in places where there are no fibroblasts for more collagen growth to be stimulated. So it's really important to go to somebody experienced, like my colleagues here, and get it done right so that you can have that feeling that you'd like. Okay, let's talk about platelet-rich plasma really quickly. We kind of hinted about it when we talked about microneedling. Dr. Skelsey, do you use it a lot, and what do you love it for?
I like it for two things. For facial rejuvenation, it is a really natural process where we apply to the face, usually after microneedling, and it stimulates the collagen a little bit faster than just microneedling by itself. I also really like it for hair growth. It has really, coupled with other agents for hair loss, it's been a game changer for a lot of people.
Excellent. What about for you?
Yeah, I would totally agree. I think it's a game changer. I think it's nice because I think patients want to use their own platelets. It feels more natural sometimes. And I agree that with microneedling, it adds an increased effect in terms of collagen. And same thing for hair loss. I think overall we need better treatments for hair loss. I will say in some of my patients it's helped them with their hair loss, but in others it hasn't, especially for those scarring alopecias. I feel like they're typically a little bit harder to treat. But I think it's a great tool to have in our toolbox. So I really love using it as well.
Excellent. Let's talk about topicals because we've been hinting about them. I'll just kind of have you list your top 3 topicals that you love, that you think will complement the lifestyle that we talked about and the procedures that we talked about to stimulate collagen growth. I'll start with you and then we'll go around.
Number 1 is sunscreen. Number 2 is sunscreen. Number 3 is sunscreen.
I love that.
So I think it's absolutely
sunscreen.
The most important part of a skincare routine. So all of the things you can do are going to be reversed with excessive sun exposure. In addition to that, or topical retinoids and antioxidants, I think are a must for everybody.
And what are the antioxidants you love to see in the ingredients?
I love to see a vitamin C. I also, in addition to the vitamin C, I like to see a niacinamide, which I think is in a lot more products these days.
True.
And I'm using more and more exosomes, which have a role as the messengers that help improve the growth factors that build up collagen.
That's awesome. Dr. Brianna, what are your top 3?
Yeah, I love her answer. I can't agree more that sunscreen is important. But for my top 3, I would say vitamin C in the morning, retinoids typically in the evening, and then peptides. I feel like I've been recommending peptides a lot recently, and I feel like I've been seeing a difference in terms of collagen building in a lot of my patients.
Absolutely. I agree with all of the topicals you all discussed. And peptides, exosomes, they're making a moment. They're still pretty new, so there's a lot more research that needs to be done. And of course, there's research that needs to be done about which ones are the best ones to use. So stay tuned. We'll be talking about that. Very quickly, just before we finish, let's just go through, each of us can say a myth about collagen that we wish people, or a misconception that we wish people would not hold on to. I'll start with you, Dr. Brianna.
That's a great question. I would say people think that you can drink your collagen. And I have not personally seen studies that show that, drinking collagen or putting it in your food or your water can help build collagen. I feel like topically, we have to work on those ingredients that we talked about earlier to help build it. But I don't necessarily think your collagen intake with food correlates to collagen within the skin, but that's my personal hot take.
And it's a topic that needs a lot of research. I'm glad you brought it up. What about you, Dr. Skelsey?
I think there's a myth that we don't build collagen after a certain age. For instance, after the age of 40, you may not be able to build collagen. That's really not true. There are interventions, both in terms of topicals, injectables, and procedures, as well as lifestyle. A diet that doesn't include a lot of high pro-inflammatory foods, for instance, as well as not smoking and, as we said, not being in the sun, of course, and having this healthy diet. I think all these things are important, but you can develop more collagen even after the age of 40.
Absolutely, it's never too late. So when we have 60-year-olds, even though, yes, they might have messed up in the past, it's never too late. For me, the myth I'd love for people to stop is that the myth that topical collagen actually penetrates the skin and helps them. So we know that topical collagen is a humectant and it feels really good and they feel moisturized when they apply those products, but they really do not penetrate the skin. So use the products we talked about earlier and not topical collagen. And then another myth or another misconception is all these red light devices that stimulate collagen. Some of them work, some of them don't. My recommendation would be to make sure you get something that's FDA cleared so that you're not wasting your money. And in general, the better products will cost a little bit more. But I think we've run out of time. It was a great discussion. Thank you all for this topic. We'll talk some more. For the viewers, please comment on things you'd love for us to talk about, things that you found interesting and things that you'll change in your skincare based on what you've heard today.
Thanks for tuning in to the True Skin Experts podcast. If you found today's episode helpful, be sure to subscribe and share with someone who might benefit. For more resources or to find an ASDS board-certified dermatologist near you, visit ASDS.net and follow at ASDS SkinMD on all social media platforms. Until next time, take care of your skin. It's with you for a lifetime.